This short video is going to go over the principles of good photography. The reason I have this video in addition to the text that accompanies this on the website is that I think that a very long paragraph talking about all the technical jargon of how I do things really has very little relevance to you and a difficult way to convey it for you so you understand it. So I want to explain to you the importance of good clinical photography and what I do to maintain absolute consistency in my photographs. First of all, I have a solitary room. I use the same room every single time, and the room is completely closed off from the surrounding areas. It has a door that locks by itself, so the door is never open during photography, so there's no ambient light coming in. Number two is the fact that I use only top-over lights. Now, for hair restoration, for rhinoplasty, those elements are not so important, but to keep consistency is important. The reason why overhead lights versus fill or flash photography is so much better is that if you're just having overhead lights, it simulates a real-world environment. For example, if you think about it, when you sit in front of your friend having lunch or in a social or professional engagement, how do you see that person? Do you see them with a flash in their face or a fill light? And the answer is no. We live in a world with just overhead lights. So I use that with just overhead lights during the photography to basically simulate a real world environment, just as if you were sitting in front of this other person and looking at my before and after. But the other thing is very important is not to use overhead lights that have just a very stark one solitary light that shines down on top of the head, because that doesn't represent reality. That causes undue shadows. So I spend a lot of time making sure that I get consistency and uniformity in my lights that are top over. It particularly has relevance when I do fat grafting or volume restoration, because then what you see is the volume enhancement in the face and how the camera really picks up and absorbs that light in order to really show the differences that are there, and it's really a real world change. When my patients that have had fat grafting come through the door at a certain distance, I can already see the amount of light that hits their face, because we live in a world with only top over lights. The second thing that's important in terms of maintaining consistency is a consistent background. If you use a very dark blue background like some places, it causes too much absorption of the face into the background, and that's a problem. I use a standard uniform light blue background. The next thing is important is camera to subject distances, and I write consistently all the time with books and articles about photography and principles of good photography. So the distances have been pre-measured. Positioning of the patient. Frankfurt horizontal plane, that is the plane that goes from the top part of the ear to the bottom part of the eye, is maintained. The position when the patient is shooting frontal, oblique, that is three-quarter views, and profile views, the patient doesn't turn the neck this way to turn sideways. I'm very cognizant of making sure that patient turns all the way. And the way that they turn is using a stool that has no back on it, so that that doesn't become an obstructive element in the photograph itself. But they're always maintaining, and anything that doesn't look quite right, I'll adjust their position before I photograph. In terms of facial plastic surgery, the thing that I don't do is have them take all the makeup off. Now, you may think that's some problem because you think there's no way you can get a good comparison with makeup, but here's the real problem. How often does a woman, for example, go out without makeup? Maybe to the gym. But in real-world situations, you wear makeup. Now, the thing that's not good is to wear more makeup on the after and less makeup on the before. I want consistency in the makeup. So there has to be some level of consistency. Because I take so many after photographs, I want to make it easy for my patients to come through, not have to strip all the makeup off. But when I do take photographs of hands, for example, for rejuvenation or other facial features, if there's a lot of obstructive jewelry and things that may cause a difficulty for you to interpret the before and after, I will have the person take those elements off. When the patient is making adjustments and positions, we also have markers on the wall to make sure that's consistent. The other thing that's important is using a standardized camera. I don't switch out 50 cameras. I use one camera for my before and afters all the time to maintain consistency. The lens is a 105 millimeter macro lens. The reason that's so important is if you have ever taken a photograph of yourself using a cheap little camera, even an expensive small digital camera, without a fixed 1-to-1 ratio, you're going to have distortion. Even when you use a zoom lens to take a photograph, you can have distortion as it moves in. And the type of distortion you can see is a barrel effect or a fisheye effect. Have you seen sometimes a nose looks distorted on a photograph? That's because a photograph was not taken with a 1-to-1 macro 105 millimeter lens, which I do, with additional vibration reduction on there. So that's just a short primer, and it's easier for me to communicate it in a video format than just in a text format about all the small details that we do on a daily basis to maintain consistency in clinical photography. My hair restoration coordinator, who is actually filming this for me, has mentioned something that I think is important, and which is the objective of why consistency is so important. Here's the real bottom line. If you don't have consistency in photography, there's no way that you can actually trust that the before and after means anything to you. There's no validity and there's no reliability in those photographs. So I want you to look at those photographs and understand that there is reliability. And the fact that what I'm showing you is a reliable change that I have done through surgical changes, not photographic manipulations. I don't Photoshop it and change contrast and try to create things. These are the images that I take in a raw format. Now, I mean, it's a JPEG compression, but I use what I mean by raw is untouched or unrefined. The only thing that I do, as I mentioned in the text, is crop the image if, for example, there is just a little bit off in the subject distance ratio. I will make sure that that is accommodated through cropping, but that's oftentimes not the case. I don't need to crop it. And so those hopefully will be a good primer for you to understand the objectives and what I'm doing with my photography.